because they're good friends. They're good friends and supporters of this network, are members from the CDEI, Centre for Data Ethics and Innovation, which is part of DCMS, and they're doing great work in the whole area of advanced analytics and ethical use and so on and so forth. And Jessica Smith is here to talk to us, and she's brought along Ben Kelly on this occasion. Jessica came with other colleagues last year, about mid-year, August, I think it was, and she started to introduce work they were doing. It was in its early stages then, sponsored and supported by the Department for Education, looking at the ethical use of data in support of children's services. And Jessica and team gave us a really good session then, and we talked about what their intentions were, and she was seeking our views and ideas, and they've moved on a pace to the point now where it's almost ready for publication. So I asked Jessica if she could come back and bring us up to date with where it's at and what will be happening next. And she'll be hopefully telling you a little bit about what they've done and the learning they've achieved and so on. So I think I've said everything I need to say. Have I missed anything off, LGA guys? Anything important? I mentioned the recording, I've mentioned the muting, I've mentioned the chat. So Jessica, over to you and Ben.
Cool. Yeah, I will pass over to Ben and just share my screen as well.
Great. I think so. Slides are appearing on my screen. I hope they are for everyone else. Fab, we'll get started then. So thank you first very much for inviting us to speak at this webinar. It's a really good opportunity for us to share where we've got to on the children's social care work and where we've come to since we last spoke to you all. So thanks very much. You may already know us. I'm Ben. I'm a policy advisor at the Centre for Data Ethics and Innovation, the CDEI. As Tim said, we're a directorate of DCMS. We lead the government's work to enable trustworthy innovation using data and AI, tackling some of the barriers to responsible data-driven innovation. So today, Jessica and I are going to give a bit of an introduction to our work developing guidance for data analytics tools in children's social care, and sort of present a bit more details about the guidance. So we're going to set out some of the context of our work and what led us to work in this area in the first place. We're going to give a quick sort of overview of the actual guidance itself and where we've got to at this stage of the game. We'd be really keen to get some of your responses and thoughts to that guidance. And then we'll also do a bit of a deep dive on bias, and you'll all be aware of what an important element of data ethics this is. We're going to go a bit sort of deep into some of the details of what our guidance says about mitigating bias in children's social care projects. And then we're also going to talk a little bit about working together to support data use as well. If we go to the next slide. So a quick recap of the project itself. So it really builds on work that the CDI has already done elsewhere in terms of bias and algorithmic decision making, including in local government, some work that we've done around supporting trust in public sector data sharing. We've worked directly with local authorities in the past to support good data governance in general, and we've been drawing up forums to understand the effects of COVID-19 on the use of data. And so this work specifically on data ethics and children's social care was really born out of opportunities and risks. So it's a clear area where there's really good opportunities for better data use, and inquiries have consistently pointed to the need for better data sharing between agencies and organizations. It's clearly an area in which there can be a huge amount of improvements made in terms of use of data. I think in specifically what works children's social care ethics review particularly identified some opportunities and flagged concerns around its data analytics and its use in children's social care. And one of its key recommendations from that outcome was the need for more sort of national guidelines to support ethical development and use. So there are clear opportunities here, but there are also clear risks, and the risks are high profile and they are severe if data analytics is not used properly and safely in this particular policy sphere. So the objectives for our guidance was to provide a sort of a practical resource for data practitioners who are developing data analytics tools, in order to allow them to innovate with data responsibly in the sector, and to enable data to be used to support more informed decision making in general. And then it was also, one of our key objectives is to support senior leaders and child family practitioners better understand the value and possibilities for data that are out there in the sector, as well as the limitations. So what does this work look like so far? Well, we've gone through sort of several phases of work, and some of this may be familiar to you who've heard from us before. We went through a first phase in January and March, which was really just to sort of engage with all of the stakeholders in the sector, understand some of the sort of the wider context of children's social care, and fully understand what we're working with. Then in the second phase, we worked really closely with stakeholders to draft some of that initial guidance. We then sort of, in the phase that we're in at the moment now, which is sort of really just testing and iterating that guidance once we had drafted it up, sort of sharing it with as many people as possible, making sure that it works for as many people as possible. And then the plan is in March is to hopefully publish the guidance, although local elections may play a role into when we can get it out there. Our intention is very much to publish the guidance not as a sort of finished product, but as a draft. Not to say that it's an unfinished in its current state, but it's supposed to be a live document. We want to continue to iterate it. We're going to continue to welcome feedback after it's officially published. And then our fifth and final phase will be that ongoing feedback loop process. So testing, implementing, iterating the guidance, working through the common challenges with as many people, with as many local government organizations as possible. So if we go to the next slide, going back to first principles a little bit, what is our concern with data analytics in children's social care, and what are the opportunities? Well, obviously those in children's services, including frontline practitioners, managers, senior leaders, they'll use data every day to help them make decisions. When you go through the list of sort of around service provision, resourcing, child safety, child's needs, type of services, interventions, all of those different use cases in that green box at the top, they all require and use data in some shape or form. And then if you look on the left-hand side, these are some of the examples of where data is collected. So around notes recorded by child and family practitioners in case management systems about children's wellbeing, statutory returns data completed by local authorities to evidence service provision and care. Then there are data sets collected by the local authority, either that they collect or receive from other local and national agencies. So there's schools, police, central government, housing trusts, the NHS, huge amount of data sharing in this space. And this data can be used effectively to tell us things about what's happening in children's services. It can tell us about service provision, tell us about the risks that group of people and individuals may face. And that on the positive side can enable more informed decision making, improve outcomes for children and families. We use data analytics deliberately as a broad term when we're talking about it in this project. We loosely divide it into sort of descriptive analytics, diagnostic analytics, and predictive analytics. I'm sure this will be familiar to most people on the call, but when we talk about descriptive analytics, we're talking about very basic calculations on data sets that we have to understand how many times something has happened or how it's changed over time. Diagnostic analytics, we're talking about slightly more complex analysis, which uses maybe statistical techniques to find patterns and correlations in some data that's sort of in historic data. And this can help explain why something has happened in the past. And then we also talk here about predictive analytics. So it usually involves much more complicated data analytics. So we're talking about maybe using machine learning model on large volumes of historic data, and then maybe applying that model to make inferences or predictions based on what could happen in the future. The goal is to take all of these different types of analytics tools and make sure that we produce some guidance that's useful no matter what level of technical maturity we're working at on this side. So building on this, what are the specific outcomes we're looking to bring about through the use of data analytics, specifically in this policy space? So if we think about some of the things that we could actually use data analytics for specifically for children's social care, insights from data analytics could help identify children and families who are vulnerable and require targeted support. So there's an element of sort of selection there. There's the fact that it could help regulate and manage practitioners' caseloads, help make sure that we're operating at maximum efficiency. It could help to identify and match children with appropriate placements and accommodations. So there's a sort of sense of decision making there that could be automated. And it could also help to identify common factors among children who entered care and help out in that sense. So in terms of the possible outcomes, we've skipped forward one, there we go. In terms of the possible outcomes that we hope that these could all bring about, if we use data analytics correctly, we could avoid more costly interventions in child's life from that identifying stage. If we help to regulate and manage practitioners' caseloads well, we could guard against overwork, burnout, high turnover, making sure that we're operating at maximum efficiency. If we help to identify and match children with appropriate placements correctly, then we can reduce the time that vulnerable children wait for placements and support sustainable placements. And effective decision-making around identifying common factors around children who entered care could ensure that services are provided which really respond to evidence around need and may be more effective. So in the way that data-driven technologies are all about improving decision-makings and assisting the human decision makers to make the best choices, in all of these key areas, there's a clear example for how it could help out. So in order to do this work, we wanted to have a really clear definition of data ethics, specifically when we're talking about children's social care. Data ethics can often be sort of discussed as in terms of quite high-level principles like transparency, accountability, security, privacy. I'm sure many of these will be quite familiar to you. When developing this guidance, we wanted to really think about what ethics means for a data practitioner or someone managing the development of data analytics in a local government context. So a set of practical ethical tools for children's social care may involve a number of things, but it could involve making sure that services meet legal regulations around child protection. It could mean making sure that there's meaningful engagement with frontline practitioners, with children and families across the design and development of a tool or product, making sure that there's relevant training, there's relevant upskilling for users. It could be about looking at the governance mechanisms, making sure that there's appropriate governance mechanisms in place, making sure there's right scrutiny, there's oversight, set appropriate boundaries around the tool and to monitor its use. We want to make sure that there would be appropriate and available data, which is of good enough quality to make sure that we're really improving decision making and improving those processes. It could involve making sure that the public communication about the tool is absolutely right. So, what's the rationale for building a tool? What are some of the technical details? How can we be really transparent and make sure that the tools are sort of really reliable? And then finally, that it could involve sort of how do we make sure that there are sufficient resources and expertise to be able to design and build a robust tool or make sure that the product is effective. So all of that thinking around sort of high-level data ethics led us to sort of the following high-level goals for what we wanted to achieve from this piece of work. We engaged really extensively with local authorities and sort of asked them, okay, well, what do you really need from a set of ethics guidance to be really effective? And this is what we found. So we knew that we wanted to produce a single authoritative document to refer to, so that you knew that there's just one place that you need to go to when you're developing a tool. So that makes sure that it aligns others' guidance, other resources, basically pulls it all into the same place. We want to make sure that the guidance is an enabler, so it enables responsible use of data. It's not around enforcement or compliance. It encourages people to consider how a tool could be used in the context of a local authority's culture, size, digital literacy, all of these things. We also heard that we wanted to make sure that it helps convey the value of data to senior leaders and managers, so that it has a sort of almost a communications perspective. We wanted it to be a source of quick reassurance for time-pressed managers, to make sure that they're doing the right things. We wanted to make sure that it includes some case studies so that we can make sure that the guidance itself replicates good practice that we've seen elsewhere across the sector. And we wanted to make sure that it provides some clarity on some of the common challenges around, say, procurement or data quality, evaluation, some of the challenges that we know to be sort of endemic to the sector. So what does the guidance actually look like, and how does it sort of match up with our design brief? Well, in the first instance, we knew that we wanted a sort of a single, it exists as a sort of single landing page on gov.uk. So we have one place where it hosts all the resources. It's sort of one place that sets the scene, introduces the guidance, and sort of points people in the right direction, so that everyone from different audiences knows where to look and knows which piece of the guidance to use. There are then 4 core parts of the guidance that exist currently. The first one is basically an introduction to data analytics. So introduces the value of data. What are the opportunities and risks for data analytics in general? What does a traditional development lifecycle look like? A real sort of introduction to the sector in general. The purpose of this is basically to be for those who want to understand data analytics or what development looks like in a bit more detail. So senior leaders in your organizations, commissioners, maybe elected members, people who are going to be making sort of very high level decisions about whether or not to pursue a certain tool or product. Making sure that it really enables that appropriate understanding and scrutiny of data analytics at the really senior level. But also around sort of managers and frontline practitioners who may use a tool or work with children and families. Then the second part is the main guidance. So this is, it's a really detailed step-by-step guide to building a data analytics tool. It sits alongside a really clear development lifecycle so that at each step of the process, okay, at this stage, we should be doing this. At this stage, we need to consider this. At this stage, we need to be asking ourselves these particular questions. And alongside that, there's an online ethics tool, which a sort of a self-assessment tool, which identifies some of the specific ethical challenges as you go through it. It is by its nature very detailed and very in-depth. It's not meant to be read cover to cover, but it's something as a sort of reference book, like a textbook, to sort of refer to, take advice from as you're going through your product. And one of the key parts of this is this ethics self-assessment is an ethics triage. This is once you've prioritized a use case that you want to develop, it's then a sort of an interactive online self-assessment. It flags some of those ethical risks to you. It explains where you should seek additional support. It's a sort of really active tool that sort of helps you out as you go along. So then the third part is an ethics workbook, and this it's almost a reference within a reference within the guidance. So it's a list of some of the key ethics questions which should be discussed and answered to demonstrate that you've considered all of the ethical risks and that you've addressed them appropriately. As you go through the main guidance, it really goes in detail with each sort of step of the way and asks you, okay, well, have you considered this? Have you considered this at each step? And the ethics workbook is designed to take that process and really condense it into a workbook that you could go through for a particular tool and make sure that you've covered all of the bases. It really it enables a bit more of a live understanding of ethical issues. It allows you to consider some of these questions maybe in your own context, and it's maybe aimed at those local authorities who are a bit more confident in developing tools or are procuring consultants or tools externally to make sure that you've gone through all the right processes. And then the fourth part of the guidance are a set of explainers, and these are sort of standalone documents which provide information and guidance on some of the more common challenges. So these are sort of, they're signposted through the main guidance, and they say, okay, if you are particularly concerned around one of these particular issues, have a look at the individual explainers, and that will be a bit more of a sort of deep dive that will give you all of the answers you need to know. So they're really useful resources for those who are actually developing these tools. It can be useful for those who don't intend to develop a tool but would like to sort of improve or use data better. But they're a sort of really focused work-throughs on particular issues. So that's what all of the guidance looks like. There's a lot of it, but it does sort of exist as a consistent whole. I'll pass over to Jessica now, who will be able to talk through some of the guidance in a bit more detail and look at exactly what it looks like.
Oh, cool, thanks, Ben. So this is just a quick view of what the development lifecycle looks like, as Ben mentioned. So it goes through explore, develop, implement, and underneath there are these kind of key lifecycle stages. And then we've just marked here about where some key decision points are, and points where you'd particularly be engaging with some of your senior leaders to get kind of sign off in developing a kind of business case before you develop a tool, and then kind of updating impact assessments and things like that before you implement the tool as well. And as Ben said, there are different ways that we think that the guidance could be used. So you would kind of start by going to the cover note, which was this kind of central resource that is hosted on gov.uk. And then kind of a senior leader, a manager, or a child practitioner working in children's services might refer predominantly to the introduction to data analytics, as Ben said, to kind of understand some of, or kind of understand the role of data analytics, understand some of the opportunities and some of the risks in children's social care. Then a procurement officer or a commissioner of children's services might refer predominantly to the procuring third-party expertise explainer, which provides kind of advice on specific terms that might need to be included in a contract, or kind of different roles and responsibilities that should be discussed either with a software developer or anyone else that you're procuring expertise from. Data or performance analysts in a local authority that might have lower data maturity, again, might predominantly refer to the introduction to data analytics and refer to some of those explainers to kind of understand how to put the kind of data foundations in place before developing data analytics tools. Then data analysts, business intelligence developers, etc., who want to develop a data analytics tool and kind of feel ready to develop a tool, would then or can then refer to the main guidance, which takes the step-by-step life cycle, can refer to the explainers to give kind of specific advice where they're facing kind of challenges, and also respond to the main questions in the ethics workbook as well. And then finally, those kind of data analysts or developers who feel quite confident in developing data analytics tools may not need to kind of use the main guidance as much, but might find it helpful to kind of respond to the questions in the ethics workbook, just to make sure that their approach is robust, that they're kind of considering the right things, and then from there can move to some of the explainers or the main guidance, again, if they need additional support. So I'm aware that that's probably quite a whistle-stop tour, but just wanted to give people an opportunity to kind of share any reflections they have on the guidance, whether you feel like you have any concerns about the guidance itself, or how you or others might use it, and if you think that there's anything missing. And then finally, thinking a little bit about how or where you think the guidance could be most helpful or relevant to you. So very happy for people to kind of take like 30 seconds to a minute or so, write some comments in the chat, and then we can have a bit of a discussion as well.
Jessica, whilst people are thinking and writing, can I just ask, is the material ready for anyone to look at yet? I know it's not completed, but have you shared it online with anybody? I don't know if our audience has seen the document yet, for example, so all they can really respond to is what you've said in this session. Is it available for people to see in its draft form?
So we've shared it for review, which has mostly been, so yeah, it's not been published anywhere online. Sorry, I haven't looked at the participant list yet, so not sure if we have shared it with anyone on today's call. I don't think we have, but it's currently undergoing kind of internal review, so we should be able to share the draft, the latest draft of the guidance in the kind of next week or so.
Good, yeah, because that will be helpful for people to make comments then. Yeah,
definitely. Tim, shall I answer your question in the chat whilst everyone's kind of taking a bit of time to think? So yeah, Tim has basically asked whether we found many examples of predictive analytics being used among stakeholders that we consulted, especially local government. And the answer is no, we didn't find too many examples of predictive analytics being used. We are aware of some local authorities exploring how risk models can be used in children's social care to kind of identify possible level of risk that an individual child might face. One area that we found predictive analytics could be quite helpful is in that we've seen a number of local authorities working with private sector developers on is around identifying children or kind of or understanding how many placements are available for children and being able to kind of better plan and allocate the right funding and the right resources. And I know that that's a particular problem across children's services teams in local authorities at the moment. And again, kind of has perhaps kind of fewer ethical risks in the sense that you're not identifying individual children or families. It's yeah, kind of about understanding resources and what funding you might need. Okay, and Juliet's question is interested in understanding whether the guidance is specific to children's services or whether you think it might have a wider applicability to analytics projects within other local government services. Yeah, that's a really good question. So although we focused predominantly on children's services and a lot of our stakeholder engagement has been specifically with children's social care teams, frontline social workers and other practitioners supporting vulnerable children and families. We do think that the resources would be applicable to a kind of broader audience, and I think as well because they're developed, well, because most of the resources are primarily for data practitioners working in local authorities, then it feels like they do have kind of use and value to other directorates as well. I think so. We haven't kind of tested the resources that we've developed with teams outside of kind of children's social care and children and family services. But I think that's something that we probably will explore in the coming months. So yes. Great, yeah, having signposting for how people in different roles or different levels of expertise could use the guidance is quite helpful. Do you disclose in the document the differing levels of technique approaches and the levels of explanation required dependent on the tool? Yeah, that's a really good question and quite a challenging one that we've been speaking about a lot over the last over a year now, when we've been working on this project. So it's quite challenging because, as you said, there can be different levels of risk to like an individual child, the complexity of the data analytics tool, the kind of scope of the tool and how many children might be affected are all things that can require a different level of governance and oversight. So we've tried to address that through the ethics triage, which, like Ben says, asks a series of questions to understand the specific risks that are related to the complexity of the tool, like the tool itself, and then the rest of the guidance talks about the kind of broader conditions that you can put in place. So, for example, putting the right governance and scrutiny in place to oversee the development of a tool, having kind of assessments on data quality, and kind of affecting decisions that way.
There was just a quick comment from Rebecca there as well. Did you see Rebecca's question about common language?
Oh, sorry, Rebecca. I haven't read that one. Question about getting common language across the broad area of children's services, which has multiple stakeholders. Frontline Services Council team and central government? Yeah, again, that's a really good question. And so we've spoken, because we've worked, or our partner for this work is DFE, but we've also engaged very closely with DLUC, which used to be MHCLG, who is responsible for kind of local government and communities policy. And like you said, there are, language can be different. So I think that we've tried to overcome that by engaging with as broad number of stakeholders as possible. So we've engaged really closely with kind of data practitioners in local authorities, but also with senior leaders, kind of directors and heads of service in children's services, as well as data analysts and information managers in children's services as well. But again, that is something that we're keen to hear from you about, whether we've got the language right, because that's really important. I'm happy to move on, and we will talk a little bit about one of the explainers that we've developed, which is on mitigating bias. And mitigating bias is something that, as Ben said earlier, the CDI has kind of done a 1.5 year long review on and looked at bias in 4 different sectors. So from local government to policing to recruitment and financial services. And it's also something that we hear that local authorities and data practitioners in particular are really interested in and would like more information about. So I was just first going to start off with a few kind of warm-up questions. So just getting you to think a little bit about how you would define bias. Think about some of the main challenges that you face in addressing bias. And then anyone's kind of experience around how they've addressed bias, where they might have been developing data analytics tools. And again, feel free to add any thoughts or comments on in the chat.
It's a really good question that you've asked, Thomas, around scrutiny for third parties. The purpose of the guidance is very much to provide local authorities with the right questions to ask, to make sure that they can provide as much scrutiny as possible for themselves around third-party provision. And I completely appreciate your point around councils buying a solution but not ensuring checks. The guidance is designed in some part to make sure that you're asking yourselves the right questions before purchasing as well as before developing. Around manipulation around third parties over their evidence is a sort of a wider sort of structural issue that is very much on our mind at CDI, but I don't think we've deliberately tried to address that specifically in this part of guidance. However, it's very much something that we're thinking of in our wider work with local government. Do correct me if I'm wrong on that one, Jess.
No, it's a really good question, and yeah, really important that where you're bringing in third parties that or where they're kind of making claims around effectiveness, that they can also demonstrate that. And I suppose one of our resources is on testing and evaluation. And I think sometimes where you're procuring tools, the third party might do that kind of testing and evaluation for you. But it can also be helpful to bring in a kind of academic team or other teams, or if you're able to do it yourself, to be able to kind of test those claims and test the effectiveness of it.
Just wonder, as we're waiting to see if anyone's got any comments, I wonder if the members of the audience listening to this, especially in the local authorities, are doing this sort of work at the minute? Do they have examples of what they're doing in the councils? Have they started to consider these sort of things? I suspect they probably haven't. Otherwise, I thought they would have been more forthcoming with comments and ideas and so on. So any of you, if you can just sort of make a quick note in the chat about whether you're doing this sort of work, and if you're not, please say so. It will reassure us that we're timely in doing this, and it's not to be surprised that you're finding it difficult to make comments to some of the questions being asked.
Yeah, Thomas, come in.
Yeah, sorry. Hopefully you can hear me. Zoom doesn't usually work that well for me, but it appears it's working for me today. So, yeah. So we started looking at children's like 2018, something like that. The response from the service was quite hostile. One particular service manager was incredibly hostile, and said you couldn't predict the work. We've had issues with data quality. We still sort of proceeded for a bit. Then the data quality was really questionable. And so ultimately it was abandoned for multiple factors, which was whilst it was clearly an area of interest and there was evidence it would work internationally, sorry, there was no appetite to do it there. So it was sort of abandoned. More from, others were interested in exploring it. They were lower risk. So that's where the focus has mainly been at the minute. I was just going to say, like, in terms of the questions asked, is it okay to extend into that as well, or into the three questions asked?
Yeah.
So, so bias is typically, I think, within a council, when you talk to colleagues, bias will be your protected characteristics. They don't tend to think of survivorship bias or potentially like geographical or even class-based work as well, or class-based issues as well, which is people from working class backgrounds may not be aware of all the things available to them in terms of services, whereas you tend to find middle class individuals are more aware of what they are entitled to from local services. But that isn't actually a protected characteristic, so you'd have to be intentionally aware of that. Again, we have geographical issues as well, which is how we distribute our staff. Some areas just have more attention because they are deprived areas. So there are question marks over whether or not we would get this many cases given the area. So we have high deprivation in, say, Nuneaton, but the south might not have as many cases. So there are questions over, how we collect data, if we even are deploying people in the correct way in the first place. So it could be a case of all the collection will keep remaining to be in some way biased. Some of those things are quite difficult to capture, particularly class. I mean, you'd have to be asking questions and collecting some information based on their backgrounds as well. And we can't even get the statutory data correct sometimes. So going into further details can be difficult. But I think I will stop now.
And Tom, forgive me, Tom, do you, what sort of communication do you do with the general public to tell them what you're doing and the strategies and the approaches you're using? Do you have to, or do you feel the need to involve them in the process so that the transparency and the reassurance side of things?
So a lot of the tools we build at the minute of a predictive nature, I would argue, are all internally facing. So they're safer. To me, they're safer areas. So they'll be around emails or audio or something like that. So that audio is probably the closest we're getting to having to inform the public, but that's still quite experimental. They would be in terms of thinking about this, yeah, if we did build a tool for children's, this came up before, which was, yes, we'd have to make people aware of some of it, but not, we may not make them aware of all the things we'd include, because it would just be a case of, if say someone was suffering with domestic violence and we saw that as a big indicator, them knowing that is a big predictor within our model could in fact lead to underreporting potentially. So it's been considered, but this was considered sort of years ago, and you know, it's been left because the guidance wasn't there, and you know, people just weren't, there was international cases but no sort of local evidence, and a lot of the councils that were doing something have done it all under NDAs and things like that, so it's not been publicly available. I think Essex were the nearest ones that were doing something, but that was being held up at the ethics point, and that was a few years ago now. So yeah, sharing and making it publicly available is something to consider, but you know, we never reached that stage, and at this point we're not doing anything to the point where we would apply it yet to a person and it being over a system. So the things that are related to people at the minute are very experimental, and we market as such at the moment.
That was really interesting. Thank you for kind of coming on and sharing that, Thomas. I think other people have said around when they think about bias, often can come from the data itself. So in terms of data quality and how it's collected, as well as bias when interpreting the data. Another challenge is around kind of assumptions made about vulnerable families. And another couple of comments have said around data being reliable, whether it's representative and reflective of the population, and understanding whether there's kind of missing data, and understanding some of the kind of where the data isn't complete. And then around observing bias towards vulnerable groups of children, and kind of harmful stereotyping in the way that kind of services are interacting with children and families. I think,
Jessica, did you find ways of mitigating that? Because that sounds quite, you did.
Oh, I will just move my slides on. So in our explainer, we have a first section, which is called At a Quick Glance, which kind of gives some high level information about the issues. So yeah, kind of decisions made around human or made by humans are shaped by individual and societal biases, which are often unconscious. And kind of decision making can vary depending on individual competence, but also on concentration levels, mood, or even when your last meal was. Algorithmic bias is when the results or insights from a data analytics tool produces an outcome that is deemed to be unfair. And as I think someone in the chat already said, it can enter a decision-making or a data-driven decision-making process at many points, including when data is collected and recorded about families and children, when a tool is designed and built, when data is selected as an input, which might kind of demonstrate, or a local authority might want to demonstrate that a child is vulnerable, when professionals are interpreting the insights from a data analytics tool, and also when a tool is retrained as well. And obviously understanding how to address and mitigate bias risks is really crucial to ensuring that tools have a positive impact and are both deemed to be and are fair. And I think, as Thomas said, kind of unfair outcomes as a result of protected characteristics are kind of discriminatory under the Equality Act. And so what we found is that many organisations are aware of the risks of bias, but can sometimes be unsure of how to address it in practice. But the risks can be managed with appropriate transparency, oversight and testing. So what can you do? And in our explainers, we highlight different ways that, or kind of different roles that teams can play. So project managers can build a diverse team who are involved in the operational development, the management and the oversight of a tool. And when we say diversity here, we mean diversity of expertise. So whether that's expertise, legal expertise, kind of subject matter and children's service expertise, as well as technical expertise, experience and skills. Project managers should assign accountability to different individuals for kind of responding to issues relating to bias and then incorporating it into roles and responsibilities. And procurement officers and commissioners should make sure that identifying and mitigating bias and testing for fairness are included in contractual agreements between the local authority and either consultant or software developer. A project team can complete an equality impact assessment, which draws on those with lived experience to understand some of the specific risks. And more broadly, project teams can work in collaboration with practitioners and those with lived experience to ensure that the tool is part of a fair decision-making process. And so I guess an example of this that we've kind of touched on previously is that a tool might kind of perfectly reflect existing inequality across the area, but this might kind of overrepresent those from lower socioeconomic backgrounds, which kind of may be seen as unfair, may be seen as kind of, that's just the reality. And then data practitioners and developers should evaluate the quality of the data being used to develop the tools, ensuring that the data sets are as representative as possible of the population. Project teams should provide appropriate training and upskilling for those using tools. So this can sometimes be children's social care practitioners, so that they understand the benefits and the risks of the tool, how it should be used effectively and appropriately, and the limitations of the tool. And kind of a final point is that kind of data practitioners and developers can regularly monitor outcomes of the tool for kind of bias, kind of understanding or exploring how data or how data around protected characteristics can play a role in helping to identify bias as well. So before we move on to the next section, does anyone have any questions? Okay, I've seen some shaking heads. So the final part of this session, we're just going to talk about the kind of final two phases of our work, which are on publishing the draft guidance and then working directly with local authorities. So it's really important for us that local authorities and other organisations supporting vulnerable children and families are supported to make better use of data. We don't want to just publish the draft guidance and kind of pass it to the local government sector. We're really keen to continue working with you and addressing challenges and understanding whether the guidance is useful, and then iterating the guidance to make sure that it is kind of a really valuable resource for you. And working with us will be really valuable, so it can help to influence the development of national policy, and it can also help to demonstrate that you're really thinking about and embedding ethics into your processes and kind of more broadly supporting good data governance. And so we're really open to working with you in lots of different ways, and we've already started working with a few different local authorities already, and have kind of outlined some of these ways here. So we kind of join regular project meetings where local authorities are developing data analytics tools, and have started to work through some of the questions in the ethics workbook to discuss your responses and kind of think about how you can make your process more robust. We're very eager to kind of keep hosting workshops which explore common challenges from improving data quality to mitigating bias. We've also talked about incorporating kind of lived experience in the design of tools through a co-design process. On testing and piloting the guidance resources, so kind of again kind of sharing those resources with you, kind of thinking about how you might use them, and then kind of giving your feedback. And with one local authority, we have shared a transparency template that CDI helped to develop, which basically can help a local authority to share information publicly about how they use data. So it kind of outlines some kind of key categories of data that it's important to share to demonstrate kind of transparent approach. And then there's also on partnering, just to establish kind of good governance and the right scrutiny and oversight. Again, we've had experience doing this in other sectors, and also with a couple of local authorities as well. But obviously we really want to hear from you, because those are just some of our ideas that we've worked with other local authorities to think about and develop. But we would love you to think about what you need to support you to use the guidance, how you might like to work with us in the future, and kind of what could we do that would have the most impact within your organisation to support kind of responsible use of data. Again, these are quite big questions, so very happy to give you a little bit of time to think about them. If anyone has any immediate thoughts, very welcome to put them in the chat, or again to come off mute.
Jessica, from the LGA's point of view, things like the transparency template you mentioned sounds extremely helpful. Is that going to form part of the materials that you're going to publish, or was that something special you did with the stakeholder council you were working with? Because, you know, to share something like that is helpful. You know, some of my questions so far have been about communicating with the public and involving everyone so that, you know, you're building trust and so on. That would be useful to make available.
Yeah. So we can, a separate team in CDI has been working on that, and as part of that project, they worked with, or they hosted lots of public engagement sessions where the public basically kind of co-developed this transparency template. So the public outlined what information they wanted to know from public sector organisations about the types of information that they wanted to know about a data-driven tool. And so that is currently available online. So we'd be really happy to share that after the session, along with the slides, if you'd like to see it. And yeah, we've also incorporated the transparency template into our guidance, because we kind of really recommend that local government use it, and think it's a really useful kind of template to follow.
Good, thank you. And again, from the LGA's point of view, I'm sure we'll talk further about this, but there's a number of things we can do. We can bring to the attention of the audiences through our various e-bulletins and so on the existence of this material, so people will know it's there. But also we can use something like this network here to put in a more specific call for involvement in health and so on, and maybe try and assemble a group of people to contribute to your workshops, or to contribute to your piloting and trials on specific aspects of the work. You know, we'd be keen to do that. I think there's a good audience in this network that will get involved, I'm sure.
Yeah, that would be great. I'm just going to go through, sorry, Thomas, feel free to come in.
Yeah, I was just going to say, is there a bit over, I can't remember all the slides, so apologies, but was there something over communicating this to kind of all members of a council? Is there anything around, like, where do you see the responsibility? Because you've named project managers or program managers or whoever, and developers. But I'm not 100% too sure if I saw anything, you know, if we're talking about children's, I don't know if I saw anything around social workers. So you said monitoring, you know, there's one thing having a predictive tool, but I vaguely remember the behavioural insight team saying that actually, depending on how much experience you had, made you trust the algorithm more or less. Again, that was work that they didn't discuss any further because it was under NDA and they wouldn't say who they were working with. But I am aware that they were doing that sort of work. Is that the type of thing that is factored in as well? So as a user of the data product?
Yeah, so in the guidance at the very beginning, one of the kind of key things that we want local authorities to think about is the data literacy of the kind of practitioners who might be using the tools, and then developing a tool that's appropriate for their data literacy. And then we also go into more detail about the types of training and upskilling that you will need to give. And obviously that will depend on the complexity of the tool, will depend on, again, practitioners' data literacy, how much they might trust a tool or not trust a tool. And so there's lots of different considerations, but yeah, the guidance does talk about that. And also with things like data quality as well, it's obviously not just down to a data practitioner to kind of assess and clean the data, but it's kind of across children's services. Different stakeholders have a role to play, from kind of commissioners or kind of procurement officers who might be involved in procuring software and case management systems, to senior leaders kind of having or kind of pushing the importance and the role of data quality, and obviously kind of practitioners who have kind of easy to record systems that they can use.
In the chat, Jane's mentioned work she's been doing in her organisation in developing a data warehouse using children's data. So she's keen to look at how your guidance can influence and contribute to the work they're doing there. Can I just ask, you've mentioned through your talks, both of you, that you've been working with other stakeholders, and you've said you've done this with a local authority and that with a local authority, and you're asking in these questions, how do we want to work with you? Can you just say a little bit about how you've worked with these stakeholders so far? You know, do you go and give them a talk or a workshop, or do you send them questionnaires, or how do you get their awareness of what you're doing and then get them to do something to contribute that's useful to you to influence what you do next? You know, what approach do you take?
Yeah, that's a really good question. So I think it can vary depending on the local authority. Some local authorities have just been really keen to kind of take the materials and go with it, and then we'll kind of attend, or we'll kind of join project meetings, kind of understand progress, work with them on common challenges. Whereas others kind of haven't been so sure about, they kind of want support but not quite sure exactly where that would be. So we've been much more involved at the beginning of a project setup to identify points which might be kind of particularly challenging, and then kind of develop more of a plan together. I think in terms of the local authorities that we've worked with, I guess we've been working in the local government sector for a little while now and have developed relationships with lots of different local authorities. And I guess through kind of one-to-one meetings with people who we know are developing or have previously developed data analytics tools and who are thinking about a lot of these questions. But we're kind of keen to make sure that we're engaging not just with those people who've already developed tools, but those who want to improve their data maturity, with people who are interested in the kind of possibilities for data analytics tools, but who might be kind of more able to develop the kind of descriptive or diagnostic types of tools as well. Does that help, Tim?
Yeah, it does. Yeah, I mean, it sounds as though you're highly flexible, in honesty, and you want to know what's going on out there and examples of practices being trialed, and then seeing how you can influence your learning to contribute to their improvement. Rebecca, can I just ask if you can unmute and just talk a little bit about what you mean by this ecosystem for children's data ethics and children's services?
Yeah, sure. I mean, I suppose there's different ways in which you can visualize this sort of stuff, and some people might respond better to more kind of visual ways of showing the information, and others might, you know, like more kind of commentary, narrative, etc. But yeah, there was a report that came out recently from the IFG, and from what I can remember, they had kind of it structured so that you've got your kind of frontline services. You might have your children's centres, NHS, education, youth services, who are all using data in a particular way. And then you've got your sort of director of children's services and their team. Well, I don't know, maybe it's a line, it doesn't have to be like on top of each other, and then you have central government who are kind of sharing information between themselves for different reasons. And I guess it would be useful to just kind of know where the points are where you might make those considerations about ethics between where the data is shared. And I just thought it might be something that would be useful or could be done in a kind of visual way, including all those stakeholder groups. So it was just to ask, you know, do you do that kind of stuff? Is that the way in which you present it? Have you thought about that? Just as a different way of showing the information, really. Thanks.
Yeah, I think that's such a brilliant point. And we have a team within CDI who will be kind of responsible for the kind of publication of our different resources, and infographics and kind of different tables and charts. We found are really useful ways to communicate kind of quite complex information, and especially where it's like system-wide, and understanding, as you said, where all the different ethics considerations should be made by whom at different points. Infographics are a really useful way to do that. So we are working with them at the moment on a few designs, and I think you share the Institute for Gov.
Yes.
Yeah, I posted the link. I mean, there might be lots of these things around, but it's just one that I remember using as a resource fairly recently, so posted it in there.
Yeah, no, that's super useful. So we will take that away and take a look. So thank you. I will just go to the final slide now.
Jessica, Tom did ask about the different tiers of local authorities and the fact that they do different services and so on. Have you tried to take account of the various different roles that different types of councils take in this work, in the content?
Yeah, I think that's a really good question as well. We've tried to engage with lots of different types of councils, so whether that's kind of a combined authority, a kind of a London borough, kind of district, just I guess all the different types of local authorities, to understand and make sure that it's kind of relevant, and that kind of works across the board. So yes, we are keen to do that. Cool. So I just wanted to say a final thank you for everyone for coming, and also for the LGA for hosting us. I hope you've enjoyed the session. So we will share these slides with you, and also the transparency standard template that we talked about earlier. And hopefully we'll share the latest draft of the guidance, which will be published in a week or so's time. And we can do that via the LGA, if that's okay. And so I suppose just as a final thing, if you have any questions or would be interested in working with us, or have any other thoughts, then do feel free to email us, or email Tim and Juliet, who will forward you on to us as well. So yeah, thank you so much for coming. And I'll pass back to Tim.
Thank you to Jessica and Ben. Jessica's actually said all the sort of things I was going to say in the rounding up the event. So thank you so much for preparing this and for coming back again and bringing us up to date. I have to say to everyone that I've actually seen the draft of the report that I read when Jessica sent it to me around Christmas time, and I thought it was really excellent. You know, it was easy to read and it was cram-packed with ideas and pointers and links to more information. And so, you know, please watch out for it, because I think you will find it useful. And if we can continue this conversation and the questions and the discussion and the promotion of this within the discussion forums in our network, please do so. So as Jessica said, we'll share the presentation with you through the usual methods on the APAN site in a day or two's time. And we tend to run a short survey just to get your feedback, so we know we're doing the right sort of things. And we've shared the link in the chat to those. So please, if you can just takes a few minutes to do, if you can just join that and click the link. Kate's just put it up again there. Look, please join and feedback to us. And that's it really. We've not got the next one planned. We'd like to think we're going to do one in March. We've got loads of ideas and we're trying to encourage people to come back to us to do things with us. If you've got ideas on themes or subjects you think we should be covering, both in these webinar series and indeed in things we do within the network itself, and please either email us at transparency@local.gov.uk, or better still, put it in the discussion forums and we can encourage conversations and refine your ideas and do what we think is helpful and what you think is helpful to do your jobs better and to learn more. So that's it really. Thank you so much to everyone for coming. I know it's difficult often when you're busy and you often forget that you've made bookings. We will keep this conversation going and we'll be in touch with you shortly through our roundups in a week or so's time on what we're planning to do in the next series. So thanks very much and goodbye.
Thanks.